So Bruce Lee said, "You should fear a man who has mastered one move 1,000 times rather than a man who has 1,000 moves of experience with him." This proverb has taught me a lot of lessons back in my training days when I was a student and my teacher used to teach me FECO. I often get this question a lot of times: how did you start learning in your initial days? So, my guru used to give me one side port in 100 patients. Just like Bruce Lee said, after you perfect your move, after you do that karate chop in 1000 opponents, after you do one side port creation in 100 cases, only then you move to the next step in phacoemulsification. As you all will be knowing, there are around 10 phaco steps in a normal routine case, and as you all know, 90% of the cases are routine. A great surgeon is not the one who operates the rarest of the rarest cases, but the one who operates maximum number of patients with perfect reproducibility and precision. No wastage of energy, no wastage of time, no wastage of motion. An ideal case like this one that is being played on the screen will be over in 5.5 minutes. And a topical case like this will be a painless procedure with minimal inflammation on post-operative day 1. So yes, there are a lot of lessons to learn from Bruce Lee, who said you should master every move in 100 patients first. I'll be slowing down this video. This is an atypical case because I'm not using the ordinary instruments in a phaco. This is a grade 2 cataract. The patient is cooperative and we'll be operating this patient under topical anesthesia. So, attention to detailing is my next lesson for you all. As you can see, I have slowed down this video and I want you to just just observe the minute movements and lessons of experience after thousands of cases that I have performed. So, as you can see, I have not pushed the air bubble cannula deep inside the anterior chamber. Just just enter the AC and inject the air bubble. And the next lesson is you should always inject the dye in pulses because it tends to get stuck up in small pockets in the anterior chamber, so it's better to flush it 3 or 4 times in the anterior chamber. As you can see, just notice this move as I have this hydration cannula on one side of the side port shifted so that there is rapid egress of the saline from the other side of the side port. And you go really distal to the air bubble, inject the visco so that the bubble comes easily from the proximal side. These are the lessons that I wanted to show you in this video. I have posted this video after a month's time because I was busy. And attention to detailing is my next lesson from this video to you all. The first lesson: always practice one single move in 100 patients and then move on to the next step. So you start the rexes from the corneal light reflex up to the 12 o'clock. Just go ahead being 3 mm's behind the torn rex's edge. Just notice the torn rex's edge and not the point of attachment of your needle to the anterior capsule. And here you go. This is a pretty decent sized rexis. It's a little on the bigger side, but nevertheless. And here you go. We'll be approaching the cornea at an angle of 30 degrees and then flattening it up a little bit to enter the anterior chamber parallel to the plane of iris so as to get a biplanar main boat. And yes, we are going ahead with the hydration part now. Just taking out that rexis flap and hydration on the right side. You must have noticed the wave. I love to just push that nucleus down to to evacuate the water trapped in between the lens and the posterior capsule. I've just coated the endothelium one last time before introducing the phaco cannula and coating the epithelium with some visco for some zooming effect and for an uninterrupted phaco. As you can see, I'm holding a dialer in my left hand and I'm holding the phaco needle in my right hand. And both of these instruments are not ideal for making a good vertical chop. A dialer is not a good chopper, and the phaco tip in this case is not exposed adequately. But still, if you have perfected your moves thousands of times, repeating and reproducing it, then I just want to say that your technique matters the most. Instruments don't matter as much as your technique does. So I am chopping this nucleus in 4 parts easily. Just take out these air bubbles, these can irritate you at times. And when you have perfected phaco chopping in thousands of cases, in hundreds of cases, I would recommend you to chop a single case in 4, even 6 parts in your initial days, just to get a feel of it. Try to chop with a blunt chopper. I won't recommend you using a very sharp chopper in your initial days, because you have a fair bit of learning curve as ophthalmic surgeons. And we are just chopped this nucleus in the bag. We are performing the phacoemulsification at the plane of iris. We are down to the last 60% of the nuclear fragments. The phaco is in pulse mode, the vacuum is around 400, and the phaco power is around 30%. I always keep 30% of energy in my routine cases, and just like that, the 20% of the nuclear remnants are there. And here you go, you see a beautiful smiling fundal glow that stares at you, and a dialer is there in your left hand, and an inadequate tip exposure. Still you were able to perform this phaco in 5.5 minutes of an average time per case. We are operating this patient free of cost under Ayushman Bharat scheme in India that is being run by our Prime Minister Narendra Modi for underprivileged age groups. And yes, just filling that bag with visco, and we are down to the erection aspiration part. I am a lover of hydro implanting the IUL, so I generally hold the irrigation cannula in my right hand first. That makes sense because you have to aspirate the cortex on the right side first and then the left side, so that there is no wastage of movements and I can straight away go to the hydro implantation of the IUL. As you can see, I have cleared the left hand side of the beg your pardon, the right hand side of the cortex, and mashing these small nuclear fragments. I tend to remove the maximum cortex at this stage sometimes, and yes, I'll switch hands, and there you go. I'm just trying to clear the left hand side of the cortex now, holding the irrigation port on my left hand right now, and we are down to the last 10% of the case. And this sequence of steps is important. If you wish to learn my steps, you can just mimic these steps in your cases. This will surely decrease your operative time, if you may. And if you're thinking what I'm doing right now, I'm just polishing the posterior capsule. This is a rough aspiration cannula which aids in polishing. And here you go, the folded hydrophobic monofocal IUL, and just like that I nudge the leading haptic inside the bag and then push the trailing haptic in the bag with my aspiration cannula. Mind you, the hydro cannula maintains its position and I am just nudging the IUL from my aspiration cannula. The anterior chamber will collapse at this point of time because there is nothing to hold it, so don't worry. As soon as you hydrate the side ports, one wall only in the side ports, one wall only in the second side port, and the roof of the main port. Do not hydrate the walls. That's all from my side. I hope you like my videos, and this was a fun philosophical video with some pretty good lessons to learn. I hope you like my stuff. Kindly like, share and subscribe. Thank you.